coverage until 26. And if the plan also includes, you have a plan that includes children, those children may not be eliminated from the plan or denied coverage for a pre-existing condition. That's in place today. And another aspect of the law that's in place today is that plans must spend 80 cents of every dollar, or 80% of the premium that are paid in, for health coverage. And if a plan doesn't fulfill that requirement, they need to refund that money directly to the premium payers. Now, for the plan in general, for the uninsured, there are some very important provisions that make it much easier to purchase health insurance than it is today, because there will be a new so-called marketplace. Used to be called exchanges. There'll be a marketplace available, which will be, there'll be several ways to access the marketplace, but individuals will be able to purchase insurance. I'm sure we'll get into all those details.
So right now, by not having health insurance, unfortunately, let's say, for example, again, if I'm uninsured, the way it's going to help me, it's going to give me all these other options if I'm a nationalist and if I'm a legal resident, et cetera, et cetera. But I will have opportunities I've never had before.
Right, absolutely. So for the current uninsured, there's an expansion of Medicaid, which in Cook County, where most of our viewers would reside, is called County Care. It's the Medicaid expansion, and it's already begun. In other parts of the country, other parts of the state, it may not begin until 2014. But here in Cook County, it's already begun, and that will make individuals eligible who are low income, between those with a little too much income to qualify for traditional Medicaid, which is 100% of the federal poverty line. But now individuals up to 138% of the poverty line can get no-cost health insurance under the expansion of Medicaid.
Can we talk a little bit more about the poverty line level? I mean, I know that we know what we're saying about that, but for the viewer who's watching, what does that mean?
Right. So every year, the federal government, the Centers for Medicare and Medicaid Services, publishes eligibility based on income, and we call this line the federal poverty line. And essentially, it's right now, it's about $11,000 when we say 100% of federal poverty line. So when I say that there's this Medicaid expansion and anyone with income up to 138% of federal poverty line, we're talking about someone who makes, an individual who makes approximately $15,000 a year. And the chart, as one can imagine, is pretty complicated depending on the number of individuals in your household. But suffice it to say, we're talking about an individual who makes about $15,000 a year would qualify for the Medicaid expansion, or a couple, two adults that make in the $21,000 range or less is what we're talking about.
Or a family of four, which is probably your typical number, which is you're working with, and a family of four who's earning about $66,000 or less?
Well, $66,000 or less would qualify for many of the benefits available under the Affordable Care Act.
Wow. So there really is something wonderful that's ready to take off for those individuals who are uninsured.
Oh, absolutely. Because individuals who are uninsured today don't have access to insurance through their employer, have limited choices, and the choices that they do have are very difficult to compare one plan to another.
Right.
And now the Affordable Care Act will include a benchmark plan in every state, and you'll be able to see which plans offer what services. And the Affordable Care Act also requires a whole set of services to be consistent from plan to plan.
Right. So let's change it up a little bit, and let me ask the question. If I asked about being uninsured, so now I'm insured, I have health insurance, is the Affordable Care Act going to help me in any way?
Oh,
and would I be paying less premiums? What if I'm insured under my employer?
Well, I wouldn't want to speculate on whether the premiums are going to go up, down, or stay the same. But because most likely they're not going to go down, and in the short term. And the reason is very simple. The Affordable Care Act requires that all of these so-called qualified plans have a whole host of services that are included at no additional cost, usually under the guise of preventative care, the categories of preventative care. So you get more than you used to if you have insurance, because your plans will now be required to have a whole host of preventative services. And we can get into those details.
Which we will, but I want to get into a little bit later, because as I was reviewing some of these updates and just looking at the additional benefits that will be provided, it's very interesting. And at the same time exciting, because not just the interest of what's being done, but the excitement of additional services for what you pay.
Right. A lot of people don't think it'll impact them. They say, well, I already have insurance, so this act doesn't impact me. But it absolutely does. Things like lifetime caps on benefits are eliminated with the Affordable Care Act. There have been additional monies provided by this act for the Medicare program, which reduces the size of the so-called donut hole, the amount people have to pay for prescription drugs. It also requires certain preventative services under Medicare to be provided without copay. So,
and just going back to the donut hole for our seniors, I mean, that's just a welcoming sign for them for services, especially on their prescriptions.
Oh, absolutely. Yeah. I think for a senior who's taking advantage of preventative care services needs to see their providers on a regular basis. The Affordable Care Act is all good news.
Right. And not worry about how often you can or shouldn't go.
Right.
Make sure you go. As scheduled, go. The Affordable Care Act today, how does it stand today? I mean, we know that this has been talked about for the last couple of years, 2010, 2008, 2009, 10. And so it's kind of like going into 3 years of the talk and some changes that have taken place. But at the same time, as it stands today, how does it stand today? We talked a little bit about just some of the services that are going to change. But right now, there is really so much less than what's going to be offered.
Oh, absolutely. Yeah. A lot's coming in 2014. Those of us here in Cook County, as I said, already have the advantage of the Medicaid expansion. Right. And so, the act has really gotten off the ground sooner for us. A lot of the act will impact individual purchasers of insurance, and as well as small businesses that will be providing insurance for the first time. A lot of that's going to happen January 1 of 2014, and the state of Illinois is working hard in partnership with the federal government to put together this marketplace. And also in the meantime, the insurance companies that provide all this private insurance are developing their qualified minimum value plans to place on the exchange. And that requires a lot of work on their part, because they have to ensure by law that they have a sufficiently large network in each geography they wish to offer the plan.
Peter, we have a caller on the air. Caller, welcome, and thank you for calling. What's your question?
Yes, my question is that I will be losing my Medicare, and will I be eligible for Medicaid under the Affordable Care Act?
Right.
You're losing your Medicare.
Right.
Okay. We will answer that for you, caller. Thank you for calling.
So generally speaking, the Medicaid and the Medicaid expansion would cover any individual who's not covered by other government plans or private insurance plans. So if in fact you're no longer eligible for Medicare, without knowing additional details, if you meet the income and citizenship requirements, you by all means would be eligible to enroll for Medicaid.
So the answer is yes.
As
long as they meet the guidelines.
Right. And the one thing I would add is that current Medicare recipients who are low income are also eligible for additional support from the Medicaid program.
All right. And with the expansion, as you mentioned, I mean, the plans are also have to justify their premiums even.
Yeah,
that's interesting. That's a huge change.
right. That's a new feature, and it's not entirely sure what the impact of that's going to be.
Okay.
But you refer to the fact that the Affordable Care Act requires insurers to limit their annual premium increases to 10%. If they are compelled to raise them more than 10%, they need to justify that increase to the state and federal government through what likely will be a very onerous process. So the thinking of Congress, most likely there is, if we make it sufficiently difficult, perhaps we'll encourage them to keep those premium increases to 10% or less. But of course, the cost of health care has a way of, causing rates to go up, and we'll just have to see how well that works.
Well, you mentioned a little bit about the Medicaid expansion, but can we just drill down just a little bit more on that and talk a little bit more about that? What
Sure.
exactly does that mean?
Sure. So across the country, states are ramping up to expand their Medicaid program. So currently, the federal government sends monies to the states, and the states then use that to provide health care, the scope of which is a little bit different in every state. And in Illinois, Medicaid is available to adults through Medicaid, to children through our children's health insurance program, which is called All Kids. And for the adults, an individual's income is limited to 100% of that previously mentioned federal poverty line. With the Medicaid expansion, the federal government is funding at 100% for the next couple of years, expanding the number of people who qualify for that program so that the state in turn can offer that to people who have one and a third or 133% of federal poverty line. I mentioned 138 because there's a 5% income exclusion. So for all practical purposes, it's 138% of the federal poverty line. But Medicaid is a no-cost, no-premium insurance program for low-income families. So it's absolutely an excellent safety net program, and anyone who thinks that their income would qualify them for Medicaid should contact the state and enroll in the program.
And which now I know that enrollment supposedly starts on October 1st, but I also understand there's some enrollments happening right now, pre-enrollments.
Right. Well, so we talked about the fact that County Care, our Medicaid expansion, is already up and running, and so individuals are welcome to enroll in County Care anytime. It's been available. There was pre-enrollment before January 1 of 2013 for a few weeks anyway, and now that we're into 2013, individuals can enroll. They can enroll at most community health centers, and certainly by contacting the county as well.
Now, for those enrollees, and I know this is a question I'm already getting from some of our callers who are calling, and what they're asking is, because they've heard of County Care, but their questions to me are, if I enroll for County Care services, does that mean I have to go to Cook County for care?
It's an excellent question. And in this case, the answer really is care is a very, very complicated word, right? There's hospitalization care, there's primary care at one's family physician, and there's specialists. So the answer is no, they don't have to go to Cook County for all of their care. They can go to any of the community health centers and many private physician groups as well throughout the city. They do need to ask their physician whether they are participants in the County Care program. But assuming they are, I'm from Heartland Health Center. We have 4 community-based clinics, including a pediatric clinic for infants and young children. And not only do we accept county care, but we will help any of our patients enroll.
And I'm going to show those listings in a second. But I do want to remind our viewers, for those of you who are just tuning in, my name is Lucy Aquino, and I am with Advocate, Illinois Masonic Medical Center, as well as affiliated with Gottlieb Memorial Hospital. And with us today, we have Mr. Peter Glaser, CFO of Heartland Health Centers here in Chicago. And our discussion today is on healthcare reform. Thank you again for being on the show. Such important information, and I know that there's a lot of talk about it, But I haven't really been seeing a lot of community programs happening where it's actually being discussed down to what I would say the nitty gritty, to the core of how this actually works and what do people need to do. And I mean, we're running across people who are actually telling us, oh, yeah, I know we're going to get covered. I know we're going to get covered. And then when you tell them, but you have to find out what it is you want and you have to enroll. Well, I didn't know I have to do that.
Yeah.
I haven't heard, no one's told me that. And that's really important. So I'm glad we're sharing this information today to make sure that we can inform our viewers and our communities as to what needs to happen when that huge open enrollment starts October 1 of this year. So going back to the, so they don't have to go to Cook County. They can basically pick. But let me ask you, now you mentioned ask your physician to see if they are a provider. Is there a list anywhere? What if your physician's not sure yet whether or not he's going to be part of it, or he is part of it, or not sure if this is something he's actually mentioning yet? Who knows?
Right.
Is there a list where someone can go to see who are providers?
With respect to county care, I would go to the Cook County Health Hospital System website to find the list of participating community health centers and providers. With respect to the rest of the Affordable Care Act and all of these insurance plans, the government website, healthcare.gov, is going to be the place to get all these lists. And I think some of the reason that you've not seen a lot of communication out in the communities is because a lot of this is being developed as we speak.
Right.
There are websites being developed, there are brochures being developed, the state is working overtime. We say October 1st is when enrollment starts, but I wouldn't be surprised if they miss it by a day or two because all of this is very new.
Right.
So I think the closer we get to October 1st, the more information will be available.
So let me jump in. You mentioned marketplace because this is what they're calling it. It used to be the exchanges, insurance exchanges. So now it's the marketplace. So we want to make sure our viewers understand that what used to be insurance exchanges is now being called marketplace. So as you hear that terminology and those words, those titles, you know exactly what it is you're looking for. So can we go back into our marketplace and let's talk a little bit about the private insurance a little bit?
Absolutely. So the marketplace will be, we'll call it a website for now, but there'll be many ways to access it. But the marketplace will be a list of insurance plans that have been vetted by the state to fulfill a number of minimum value requirements. They'll be organized by geography, so individuals will be able to quickly assess which plans they might be eligible for. And they'll also be organized into tiers. There hasn't been a lot of information published yet, but we've been led to believe that there'll be 4 tiers, which they're calling bronze, silver, gold, and platinum. And of course, bronze will be the least expensive and have most likely the highest deductibles and copays. And of course, for those who can afford a higher tier, which would be a higher premium, there'll be lower deductibles and copays. But the marketplace will be simply private insurance. It'll be open to anyone to purchase insurance. However, it's expected that the individuals who use the marketplace will be individuals and families that will qualify for some credits to reduce the premium cost. And at over 400% of the federal poverty line, there are no longer any credits, income credits available for people.
So let's walk through this a little bit. You mentioned credits. Can you give us an example?
Yeah. It's a little different than your traditional tax credit. Your traditional tax credit is offered to someone, and they have to wait until they file their tax return, typically, after the end of the year, and then they get a tax refund because they're taking advantage of that credit. But in this new world of the Affordable Care Act, an individual will fill out a single application. I'll talk about that in a moment. But they'll go to the marketplace because they don't have any other options for insurance through an employer, and they will fill out an application based upon their income and their number of people in their family, where they reside. and they will get a number of plans from a number of private insurers. All the big insurers are likely to be represented, the United Healthcares and Blue Cross Blue Shields and Cignas, etc. And then one will be able to see the monthly premium cost for each plan and what each plan offers and where they differ and where they're similar, and also the amount of the tax credit that one's income makes them eligible for. And what makes this tax credit different is, should one choose to purchase that plan, that tax credit is directly applicable to the monthly premium. For example, if you choose a plan which covers your family for, purely an example, $300 a month, and because of your income, the government is going to give you a $1,200 a year or $100 a month tax credit. You can check the box that says, apply that to my monthly premium, and you'll now receive a bill every month for only $200 because the government is picking up the rest
of that.
with
So
the tax
it's an instant credit.
Absolutely right.
I am sure that a lot of individuals are going to be very happy to receive
Right,
that.
that'll be nice. And then for individuals, if I may continue, that have limited income under 250% of the federal poverty line, there will be additional reductions in co-payments as well as reductions in deductibles for people with limited income. So it's not just the government's going to throw a little money at you and say, good luck buying the same insurance that everyone else buys, but individuals with who are a little lower on the income scale will not only get a credit for the premium, but will also have lower out-of-pocket costs day in and day out when they see their providers because they'll be able to take advantage of those discounts.
Okay. Now, I also heard there's a penalty involved if you don't enroll into an insurance plan.
Right.
If you want to call it that.
Yeah. So the Affordable Care Act does have this presumption that everyone who's eligible to be insured becomes insured. And the incentive there is a penalty for individuals who choose not to be insured. So let me start by saying that there is no penalty for someone who's below 100% of the federal poverty line who does not sign up for an insurance program. I would encourage everyone at that income level to at least sign up for a Medicaid program.
Absolutely.
But individuals who are low income would not receive any penalty. Above that, there is a tax penalty for individuals who either have the opportunity to purchase insurance either through the exchange or through their employer and choose to remain uninsured.
Wow. So now I'm back at work. I am employed, and I have an employer-sponsored insurance. Will that employer in any way be affected by the reform?
Yeah, there are a few impacts. One is the requirements of the Affordable Care Act to standardize a number of services. So your employer's plan will likely change a little bit January 1 of 2014 to ensure that it includes the preventative services that we've discussed. We haven't talked about it too much, but this might be a good time to.
Absolutely.
There are 16 preventative services required by all insurance plans that are so-called qualified plans for adults. There are an additional set of 22 covered services for women specifically, and a set of 27 additional services for children. I won't go through them all, but there are things like diabetes screenings, cardiac care screenings, cholesterol, etc., cancer screenings, colonoscopy, mammography, virus screenings for HIV for at-risk individuals, or HPV on the women's list, iron deficiency for the children's list,
autism
hearing,
for the
vision,
children's kid, for the children,
screening.
depression, developmental.
There are a lot of them.
There's a host of them.
All of these things need to be covered. Now, many plans have covered these before, but with the traditional co-payments and deductibles. Now, there will be no deductible or co-payments required. So once one pays one's monthly premium, you can make that annual appointment with the physician and get these screenings and services at no additional cost.
Now, I'm really excited to see the adult immunizations is also going to be part of the preventative medicine, which it has not been covered. We hear that a lot, especially with
Right.
our older adults and shingles.
Right. I mean, that is just
Right.
good public health
Yes.
policy that has made its way into the Affordable Care Act.
So open enrollment, we know that we talked a little bit about the initial date that they're looking at for enrollment to begin is October 1st. You mentioned that might be a little bit delayed. But as people are preparing, what are some of the things and steps they should take in order to prepare for that enrollment date?
Right. There are definitely things that one can begin to do today to get ready for October 1st. The first thing is for individuals who are not active purchasers of health insurance or haven't bought health insurance for a while, they may not be familiar with these terms that we're throwing around: copay, deductible, in-network, out-of-network, primary care physician, specialist, etc. So begin to get familiar with those terms. There's some excellent materials at healthcare.gov. You can contact your physician's office, ask your questions, but begin to become familiar with this terminology, because it'll be important when one begins to compare plans that you understand these various concepts. The next thing is to gather some of your information. Begin to do a budget. How much health care can you afford? How much monthly premium can you afford as a family? So start putting some numbers down so you have an idea of which plans might be right for you. Then, of course, closer to October 1st, you'll need to gather proof of income, a month or more of pay stubs or unemployment checks, or a letter from an employer stating your income, or
Return.
Tax
Annual
return
return.
information,
Right.
as well as a Social Security card or other proof of citizenship materials such as passports and citizenship papers. These are all the materials that one can begin to gather in preparation for October 1st.
Right. Before I forget, I do want to remind our viewers that with Peter being with Heartland Health Centers, these are some of the locations in which he mentioned where you can call to get additional information or to enroll for county care. And you can reach them either at the Wilson location in Chicago, the Lincoln Square location, Rogers Park location, and the Lakeview location. The Lakeview location is located on the campus of Advocate Illinois Masonic Medical Center, and then you have the others and the phone numbers there. If you want to take a second to write those down, or you can call the Hispanocare office, in which we'll be there to give you any information that you need and to provide you with that. Once again, Heartland Health Centers, in which you can call for additional information, or you can visit them at www.heartlandhealthcenters.org. So prepare your list, have your check-off list, make sure know what it is you're going after. And you mentioned, .gov. That site's it's pretty up to date. I mean, it has a lot of information. I managed to get onto it before we came today, just to kind of see where they were at compared to a few months ago. And they have really added a lot.
Right. There's a lot there.
Yeah.
As I said, there are brochures. There's targeted information. It'll say for African American families,
Right.
here's some information for you. For Latino families, here's some information for you. For older citizens, etc. So that's very nice. There are a number of videos that explain things very clearly. And as you said, it's being kept up to date,
Yes.
changing often. I'd also like to say, we talk about October 1st, but there's going to be a very, very expanded open enrollment period in the first year. So if individuals hope to have coverage by January 1 of 2014, then by all means they should
Right.
get themselves ready for the October-November timeframe.
Right.
But open enrollment will be available from October all the way through March 31 of 2014. So there's it's not a tragedy if you put it off until December 1st.
Right.
There's not a problem at all.
So even if you enroll on January 2nd, you'll still be covered in 2014.
Absolutely. Your coverage will begin, a few weeks after
Right.
your application is accepted, and probably paid your first premium. But it goes through March, and then subsequent years, we've been told it'll be a much more traditional open enrollment period, which would be from mid-October through early December. So the traditional dates would be October 15 through December 7, which individuals familiar with private insurance or Medicare would consider a normal open enrollment period.
Right. So we know what folks have to do. If there was any advice that you can give to our viewers, what would it be?
Well, I think, first of all, spread the word. You are now more informed than 98% of citizens out there. Also, the next step is to speak to your family physician. Get to understand what networks they're in, because you may be choosing a different health plan than you have today, and you want to ensure that you can continue to see the providers that you like and know you. And also, most physicians have a benefits specialist on staff, and that benefit specialist can assist you with both public and private insurance and answer a lot of these questions.
That's great. Thank you. Our time here goes by so quickly, and we can keep talking about this because there's so many wonderful things that are coming, and really encourage our viewers to get better acquainted with everything that we're talking about by visiting .gov and or calling the Heartland Alliances. Again, I want to show you those numbers. If you'd like to call Heartland Alliance Health Centers, you can reach them at any of these locations, at the Wilson location, and these are all in the Chicagoland area. Wilson, Lincoln Square, Rogers Park, and Lakeview, which is in the campus of Illinois Masonic Medical Center, and that's our pediatric site. Or you can visit Heartland, www.heartlandhealthcenters.org. And if you forget all of those numbers, you can always call us at Hispanocare, where you can reach us at Illinois Masonic Medical Center, and you can reach us by calling at 773-296-7157 in the event you forgot the numbers for Heartland. Lots of information coming our way. Lots of things to stay in tune with. Because of the Affordable Care Act, pre-existing conditions can no longer be denied due to medical conditions. This will be a thing of the past for every American. Starting in 2014, individuals without health insurance will be able to buy coverage in the health insurance marketplace. Open enrollment begins October 1st. We hope. Get ready. So on behalf of my colleagues at Hispanocare, Illinois Masonic Medical Center, Gottlieb Memorial Hospital, and especially to Mr. Peter Glaser, thank you very much for being on the show today and for sharing with us such important information. And I'd like to thank our Advocate Illinois Masonic Medical Center and for their continuing support of affordable, accessible, bilingual, and bicultural health care to Chicago's Latinos communities and all communities across the board. My name is Lucy Aquino, and I represent Hispanocare of Advocate Illinois Masonic, and I'd like to thank you for watching CAN TV Cable 21. Until next time, we invite you to stay tuned for more interesting and exciting information coming your way. Until next time, thank you for joining us.